Thank you for giving me the chance to present my talk in ILLS 2021. I'm Seok-Kyun Hong at Seoul National University Hospital. Today I'd like to give a presentation titled Demarcating the Exact Midplane of the Liver using Indocyanine Green Near-Infrared Fluorescence Imaging during laparoscopic donor hepatectomy. The authors of this manuscript have no conflicts of interest to disclose. Indocyanine Green ICG is a near-infrared fluorescent dye certified by the FDA. ICG is mainly metabolized by hepatocytes and excreted through the biliary system. During an operation, ICG Fluoroscopy allows for real-time dynamic observation of anatomical structures. Multiple institutions over the world have implanted ICG near-infrared fluorescence imaging to various fields of laparoscopic surgery. In hepatobiliary surgery, ICG fluorescence has been demonstrated to provide clear anatomical guidance for the following procedures. In pure laparoscopic donor hepatectomy, ICG is particularly useful for liver midplane demarcation and optimal bile duct division. Despite the extensive use of ICG fluoroscopy in pure laparoscopic donor hepatectomy, its effectiveness has not been specifically analyzed or quantitated for objective comparison to the traditional liver midplane demarcation method. The current study aims to quantitatively evaluate the effectiveness of ICG fluoroscopy during liver midplane dissection in pure laparoscopic donor hepatectomy and to demonstrate that a single injection of ICG is adequate for completion of both midplane dissection and consecutive bile duct division. This study is a retrospective study which took place at Seoul National University Hospital. The study period was set to 1 year from June 2016 to May 2017 because ICG fluorescence has been routinely applied to pure laparoscopic donor hepatectomy at our institution since May 2016. 46 donors who had full intraoperative video recordings saved in our database were enrolled. This is the short video clip.
Here, I would like to share a short video clip summarizing PLDH. The inflow vessels of the targeted hemiliver were temporarily clamped. Immediately, low-dose ICG was injected intravenously, and the near-infrared camera was turned on for observations in the color fluorescent mode and black and white mode. The demarcation line was marked with electrocauterization along the surface of the liver. The near-infrared camera was switched off, and the inflow vessels were declamped. The liver parenchyma was resected along the exact midplane of the liver. Upon exposure of the anterior surface of the hilar plate, the near-infrared camera was turned on again for identification of the optimal bile duct division point. The hepatic ducts were carefully dissected and ligated. In all 46 cases, the operators, assistants, and scopists were able to recognize that ICG fluoroscopy provides a definite advantage
for a quantitative evaluation of the effectiveness of ICG. Image analysis software was used to measure the color intensity value and luminosity value of designated regions. Upon selection of 1 cm and 1 cm size box-shaped region of interest, the histogram function of the software provided us with the average color intensity and luminosity of all pixels located within the box. As shown here, 5 boxes each were acquired from the clamped and non-clamped regions near the alleged liver midplane. The average color intensity value and luminosity value of the 5 boxes in each region were calculated. Images were captured in the A natural mode and the B black and white mode and the C color fluorescence mode. The time from when ICG was injected to when the near-infrared camera was turned on for bile duct visualization was measured. The time from when the near-infrared camera was turned on for bile duct visualization to when bile duct division was completed was also measured. Donor characteristics and outcomes are shown in detail here. 3 donors experienced Clavien-Dindo grade 1 or 2 postoperative complications, which is 1 biliary leakage, which resolved spontaneously, 1 infection, which was treated with antibiotics, and 1 biliary leakage, which resulted in rehospitalization and was treated with antibiotics. The following whisker plots depict the color intensity values of the clamped versus non-clamped hemilivers visualized in the natural, black and white, and color fluorescence views. In all 3 visualization modes, the differences in color intensity between the clamped versus non-clamped regions were statistically significant. Using repeated measures ANOVA, we determined that the strongest contrast in color intensity between the clamped and non-clamped hemilivers was achieved when ICG fluorescence was visualized in the black and white mode. The following whisker plots depict the luminosity values of the clamped versus non-clamped hemilivers visualized in the natural, black and white, and color fluorescent views. In all 3 visualization modes, the differences in luminosity between the clamped versus non-clamped regions were statistically significant. And again, using repeated measures ANOVA, we noticed that the luminosity values did not meet the homogeneity of variances assumption. The differences in luminosity plotted here were excluded from our analysis. The time from when ICG was injected to when the near-infrared camera was turned on for bile duct visualization was 85.6 minutes. The time from when the near-infrared camera was turned on for bile duct visualization to when bile duct division was completed was 8.7 minutes. So in summary, both the color intensity and luminosity values of the clamped versus non-clamped hemilivers showed statistically significant differences in the natural, black and white, and color fluorescent camera modes. The color intensity values showed the largest difference between the clamped versus non-clamped hemilivers when ICG fluoroscopic staining was viewed in the black and white mode. A single injection of ICG administered before liver midplane dissection persisted long enough for completion of bile duct identification and visualization division. In conclusion, ICG fluoroscopy visualized with black and white imaging is most effective for demarcating the exact midplane of the liver in pure laparoscopic donor hepatectomy, and a single intravenous injection of low-dose ICG is sufficient for both liver midplane demarcation and bile duct division. Thank you for your attention.